Hi, my name is Jeremy Beckworth, and we're going to be talking about popular diets. We're going to discuss low-carb diets or keto diets, Mediterranean diets, plant-based diets, and intermittent fasting, what these are and what the data is for each of them. So we'll start with the low-carb diets. We'll get into that first. So low-carb diets, are they good or bad overall for your health? What would you guess? So they can help you lose weight, but this is a systematic review looking at all-cause mortality or all-cause death, that there was a 31% increase in all-cause mortality or death with low-carb diet. So that is less favorable. So the question is, does it impact cholesterol? Do low-carb diets, keto diets impact cholesterol? Well, they do. This looked at various diets. On the left side would be the low-carb keto diets, such as Atkins or the protein power diets. And you can see the effect on cholesterol is to raise total cholesterol. So that is less favorable. You go more to the right side, these are plant-based diets, such as the high fiber, the Pritikin diet, and the Ornish diet. Dean Ornish is the one that showed reversal of coronary artery disease, and you can see a marked reduction in total cholesterol. So from a cholesterol perspective, low-carb diets less favorable. So low-carb diets had a negative impact on flow-mediated dilation after 6 weeks. You can see the paper here says flow-mediated dilation improved on the low-fat diet, but was reduced in the low-carb diet. So less favorable for your artery's ability to dilate, a health of the artery. So in this systematic review and meta-analysis of a number of studies, their conclusion was that low-carb diets were associated with significant decrease in flow-mediated dilation. So the ability of the artery to dilate, which is important, was impaired in the low-carb diets, especially when compared to low-fat counterparts. How about low-carb diets among people who've had prior heart attacks, myocardial infarctions? Well, there was a 51% increased risk of cardiovascular mortality. So about a 50% increase in death among people who had heart attacks who were on a low-carb diet. So less favorable, again, from a vascular perspective. So this is a paper that suggested that low-carb diets are bad for coronary blood flow. The effects of high-protein diets on coronary blood flow had a negative impact. So looking at various studies, the synopsis is that low-carb diets are worse for diabetes. It's well known that if you get fat within the cell, within the muscle cell specifically, it causes insulin resistance. It's associated with bone loss, kidney stones. It's nutritionally deficient, associated with constipation. It's bad for the gut flora, and there's loss of muscle mass. So this study looked at the 3-month effects of a ketogenic diet on body composition, blood parameters, performance metrics, and CrossFit trainees. And they found that the muscle of the thighs were 8% smaller despite exercising. There was loss of muscle mass. And if you look here, this is on the left side here is on a carb diet, and this is on a keto diet. So carb diet, keto diet. And you can see here that there was weight loss both with the carb diet and with the keto diet. So there certainly can be some weight loss with the keto diet. But if you look at the percent body fat loss, there was a steady loss of body fat with the carb diet, but once you turn to the keto diet, there's less loss of body fat. So they highlight in this paper that body fat loss slowed during the keto diet. So there's less fat loss during the keto diet and increased lean muscle loss. So in summary, for low-carb diets, you can lose weight with this, but there are a lot of negative downsides. There's an increase in all-cause mortality that we looked at, increase in cholesterol levels. There's a 51% increase in cardiovascular death among people who've previously had a heart attack that did a keto or low-carb diet. Negatively impacts coronary blood flow around the heart. It's worse for diabetes. There's bone loss that is seen, and there's muscle loss. So moving on, we'll talk now about the Mediterranean diet. So is the Mediterranean diet helpful? We're going to look at 4 of the big studies that have been done on Mediterranean diets. Initially, the Ansel Keys studies, the Leon Hart study, PrediMed study, and a JAMA internal medicine review study of Mediterranean diets. So what exactly is a Mediterranean diet? It's a very in topic, but what is its history? What is a Mediterranean diet? So this was initially studied post-World War II in 1952. Impressed with the low rates of heart disease in the region, Ansel Keys initiated a series of investigations of dietary and other coronary risk factors with colleagues in 7 countries. So Ansel Keys looked at over 15 years, 7 countries, and this is a table looking at 15-year death rates per 10,000 healthy men, ages 40 to 59. And you can see here in Crete, the risk of heart disease, dying from heart disease, was 20 times lower than what was seen in the United States. And so this was quite notable. Now, this was not across the board in all Mediterranean studies, but specifically in Crete, Greece. What were they eating there? Well, they were eating 93% of their diet was a plant-based diet. 7% was made up by meat, fish, eggs, and dairy. So it was primarily a vegetarian or plant-based diet. The traditional Mediterranean diet has changed. The prevalence of heart disease was very low back in the 1960s, now much higher in more recent studies. And the significant changes seen in the Cretan diet over those years, which changed from a primarily vegetarian diet to a more Western diet, has been associated with that. So this was a meta-analysis looking at a number of different studies looking at health status based on a Mediterranean diet, and they scored it the more points for plant-based part of the diet, less points when they ate more meat or dairy. And what they found was the better the score, the more plant-based this Mediterranean diet, the more protective it was from heart disease. The relative risk being less than 1 is protective, and this meta-analysis shows that the higher, the better the score, the more protective it was from heart disease. So one of the big Mediterranean diet studies is the Lyon Heart Study. It was a randomized controlled trial after a heart attack. Patients were randomly assigned either to an experimental group or a control group. And the experimental group, they ate less meat, butter, and cream, more breads and fruit, same amount of oil, fish, and wine. And what they found after 4 years, there's 1/3 the number of cardiac events, whether heart attacks or cardiac death, by cutting meat, butter, and cream. Look here, in the experimental group, 14 total endpoints versus 44, so about 1/3 less. So protected from a cardiac event by cutting meat, butter, and cream. The PREDIMED study was a big Mediterranean diet study. They took people that were at high risk for cardiovascular disease, and there was 3 groups. There was a Mediterranean diet supplemented with extra virgin olive oil, mixed nuts, or a control diet with advice to reduce dietary fat. And they noticed over time when you looked at the carotid ultrasounds that only the nut group had a regression of the carotid artery plaques. The control diet and the olive oil group actually did worse over time. So in this PREDIMED study, the number of strokes were cut in half with the Mediterranean diet compared to the Mediterranean diet with olive oil and the control diet. There was no difference in number of heart attacks. So in the nut group, it was protective for strokes, but not at all for heart attacks. So in summary, for the PREDIMED study, there were less strokes in the nut group, about 50% when compared to the control group. It was not protective for heart attacks. The olive oil group did not see that same benefit for the stroke reduction. And carotid artery thickness worsened in the control group and the olive oil group, but the nut group, there was some improvement. And Dean Ornish, the gentleman who's shown improvement with coronary artery disease on a plant-based diet, highlighted this in the New England Journal of Medicine commentary that a Mediterranean diet is better than what most people are consuming, but even better is a diet based on whole foods and plants. So what 2 factors with the Mediterranean diet are protective for heart disease? This is a JAMA Internal Medicine article that reviewed the Mediterranean diet studies, and they found 2 factors with the Mediterranean diet that were protective for heart disease. What were those? So interestingly, what they found, the 2 items that were protective from a cardiovascular perspective were vegetables and nuts. That led to less cardiovascular events. There was no association with olive oil, fish, and wine. So there's protection from a cardiovascular perspective with vegetables and nuts, but not so with olive oil, fish, and wine. So in summary, is the Mediterranean diet helpful? Well, the initial study, the Ansel Keys, back in the 1950s and 60s showed that there was 20% less heart disease than in the U.S. In Crete specifically. This was not across the region, but Crete, and 93% of the diet was vegetarian. That was a historical thing not currently seen in the Mediterranean. The Lyon Heart Study, 1/3 the rate of heart attacks by cutting meat, butter, and cream. The Predimed Study, there was a 50% reduction in stroke risk in the nut group, no difference in heart attacks. Plaques in the arteries grew in the control group and in the olive oil group. And the JAMA Internal Medicine Study showed for cardiovascular disease, the two things that were beneficial were vegetables and nuts. There was no benefit from oil, fish, or wine. So moving on, we've talked about low-carb diets. We've talked about Mediterranean diets. Now we're going to talk about plant-based diets, vegetarian or vegan diets. What is the data for these? So what are the top killers in America? If you look at the CDC, as they published, what are the top killers in America? Well, the top two are heart disease and cancer. Those are the top two. So we're going to highlight, are there any studies on these top two causes of death with plant-based diets? So Dean Ornish from University of California, San Francisco, he took patients with advanced heart disease and put them on a whole food plant-based diet with no added oils, exercise, and stress management. And 82% of people had regression of their narrowed arteries on repeat imaging, 91% decreased frequency of chest pain. So this was published a number of years ago in Lancet. Caldwell Esselstyn at the Cleveland Clinic has done some similar studies. 70% of people saw opening of their clogged arteries on repeat angiograms, cardiac catheterization. So in another case series, Caldwell Esselstyn, 198 consecutive heart disease patients were placed on a whole food plant-based diet, no oil. They followed them for 3.7 years, and 177 of the 198 were adherent to the program. 21 were non-adherent. Of those who were adherent, 99.4% did not have any recurrent events. So they avoided progression of their disease. 21 of those 21 that were non-adherent, only 38% of those did not have recurrent events. So the majority had recurrent events off the program, where 99% on the program did not have recurrent events. So this is a published image from the Cleveland Clinic showing a diseased artery before and then in less than 3 years on their program. Notable opening. This is not from a bypass or stenting, but this is from dietary intervention alone. So this is an impressive stress test. This is showing lack of blood flow in the heart muscle here in this section of the heart. Within 3 weeks, there's improved blood flow. Again, these are published images from Dr. Caldwell Esselstyn at the Cleveland Clinic. 3 weeks on the plant-based nutrition. So very impressive images. And again, there's good solid data for coronary artery or heart disease. And Dean Ornish in California, his program, there's enough data that even insurance covers it, Medicare included. So moving on from heart disease now onto cancer. There are studies on cancer as well for plant-based nutrition. This is an animal study by Dr. T. Colin Campbell. And in an animal model where animals had low-grade liver cancer, they would give them 20% casein in their diet, which is a protein found in milk, and then they would take it off. And interestingly, they found that there was no cancer growth when they were excluded the casein protein, but when they added that 20% to their diet, the cancer grew. They took it off, the cancer decreased, and then it would grow when they would put it back on, and then decrease as they came off. So they could actually turn on and off the cancer simply by adding casein, the protein found in milk, to their diet in an animal model. Dean Ornish did a study in individuals with prostate cancer where they could be monitored. They were not at the point where they had to have surgery or do radiation, and he divided them into two groups. One was a control group, just standard of care, just monitoring them. And the other group did the dietary lifestyle intervention where they went on a whole food plant-based diet, avoided added oils. They did exercise and stress reduction. And you can see the control group, PSAs went up over a 12-month period, where in the treatment group, the PSAs went down. And so there was actually improvement in the prostate cancer over a 12-month period with this intervention. They looked at MR spectroscopies with an improvement. You can see here active prostate cancer. A year later, there was less prostate cancer seen on the MR spectroscopy. PSAs, as mentioned, went down. Cancer cells were inhibited by exposure to blood in the lifestyle group by about 70%. So in a petri dish, took the blood, put the cancer cells, and there was a 70% reduction in cancer cell growth compared to the control group. If you look at the World Health Organization's carcinogen classification, class 1 is thought to be very carcinogenic. There's good data saying these items cause cancer. And in there, they include processed meats. So it is a class 1 World Health Organization carcinogen. So meats, class 2 are probably carcinogenic. There's good data, but they consider it probably carcinogenic, and that would be red meat. So processed meats have been shown to be a class 1 carcinogen, class 2A, probably carcinogenic is red meat, according to the World Health Organization. So moving on from heart disease and cancer, now talking about body mass index and plant-based diets. What is the ideal body mass index? Well, ideal is defined as 18.5 to 25. Overweight is 25 to 30. Obese is greater than 30. Morbidly obese is greater than 40. So looking at the Adventist Health Study 2, 60,000 participants here, and you can look at the various diets from non-vegetarian all the way to vegan. So you can see body mass index, how it sequentially goes down. And once you get to the fully plant-based diet, that was the only group that was considered the ideal body mass index. Similar for type 2 diabetes, the more plant-based you go, the lower the risk of type 2 diabetes. But the comment that's commonly given is, do vegetarians or vegans get enough protein? Well, that has been answered. Back to the Adventist Health Study 2, they looked at, do vegetarians get enough protein? Well, they looked from the meat eating all the way to vegetarian and vegan diets. And across the board, protein intake was actually very similar. And as long as you're eating enough food, no matter what diet you're on, you get enough protein. So there's no question you get enough protein whether you're eating a meat diet or a vegan diet or vegetarian diet. Then the other comment sometimes people will make, well, animal proteins, they seem to be superior to plant proteins. Well, that's not been shown to be the case. This is looking at in older individuals, the gait speed, looking at plant versus animal protein. There was no difference or superiority. Replacing animal protein with plant protein, there was no increased risk for sarcopenia, that is muscle loss. So there was no added advantage of meat protein versus plant. The key is that you're getting adequate protein intake, whether it's from a meat source or a plant source. And adequate protein has been suggested to be at the 0.8 milligrams per kilogram, but there's been a number of studies that suggest getting 1.2 milligrams per kilogram. There's less sarcopenia or muscle loss as we age, as much as 40% less. So you get plenty of protein on a plant-based diet. It is good, though, to make sure you're getting enough protein, whatever diet you're on, for the less risk of sarcopenia, less risk of muscle loss as we age. So what is missing in the U.S. diet? So we get plenty of protein, we've established that, but what is missing? 97% of Americans don't get enough of something in their diet, and what that is fiber. Dietary fiber, less than 3% of Americans get adequate fiber intake. So 97% of Americans are not getting enough fiber. So where do we get fiber from? It only comes from plant sources. It doesn't come from meat, dairy, butter, etc. And fiber intake, again, looking at from a semi-vegetarian, vegetarian, strict vegetarian, the fiber intake goes up the closer you are to a plant-based diet. So in summary, we've talked about low-carb diets, Mediterranean diets, plant-based diets. Now we're going to go to intermittent fasting. What is the data for this? So intermittent fasting or time-restricted eating, there has been consistent evidence that shows improvement in weight, insulin, lipids, blood pressure, inflammation, and in autoimmune diseases. So the most common time-restricted eating or intermittent fasting pattern that has been studied is the 16-8 pattern, where you eat within an 8-hour window, and then it's water fasting within a 16-hour window. So for example, if you eat at 8 a.m. for breakfast and then 4 p.m. for dinner, and it's really water after that and water between those meals, there is also the 1 to 2 days a week intermittent fasting, 5 to 2 pattern, 5 days of eating, 2 days of water fasting, alternate day eating, where you eat one day, water fast the other days, one meal a day. And then there's been a lot of studies on fasting mimicking diets, which we will not get into here. Studies have shown that early eating windows, so starting in the morning, ending in the afternoon, does better than late windows in regards to lipids, blood pressure, glucose, weight, and inflammation. So if you were to eat from 8 a.m. to 4 p.m., those folks do much better than do those who would eat, say, at noontime to 8 p.m. In regards, again, to cholesterol, lipids, blood pressure, glucose, weight, and markers of inflammation are notably better in those earlier eating windows. So are these ideas new? Well, actually, no. There were books going back over 100 years ago that this was the practice that was suggested. Practice of eating 2 meals a day is generally found to be a better health, and making your breakfast your the heartiest meal of the day. So these ideas have been around. Just recently, those studies have shown this to be true. So there are fascinating studies with intermittent fasting in animals. So this was a study where mice were blasted with radiation, and within 30 days, 70% of the mice died. If you look here, within a 30-day period, this is a survival curve, there's about 70% of the mice die. But if they had been doing every other day fasting for 6 weeks prior, none of the mice died. So fasting had a profound impact on the survival of these mice when they were exposed to high-dose radiation. So this is another animal study on mice where they were exposed to high-dose chemotherapy. And one group of the mice were water fasted for 2.5 days prior to the high-dose chemotherapy. And you can see here, exposure to high-dose chemotherapy within 5 days, the standard mice died, 100% of them died. If they had been water fasting for 2.5 days prior, you can see the survival curve, 100% of them survived. So there's really a powerful impact, at least in an animal model, of survival with high-dose chemo exposure in mice. So fascinating. The thought is that fasting or intermittent fasting turns cells into a quiescent mode, and they're more in a repair mode, and they're better able to withstand chemotherapy, things like radiation. So those prior studies were on animals. Are there any human studies? Yes, there are human studies. This is one looking at chemotherapy, and they divided individuals into 3 groups: those who had fasted 24 hours, 48 hours, or 72 hours prior. And it was a water fast, but they did allow less than 200 calories a day, which would be about a bagel or 2 bananas each day. So 3 groups at those 3 time frames. So looking at those groups, comparing 72 hours versus 24 hours of fasting, the 72-hour group had less nausea, vomiting, nerve damage, and bone marrow suppression. So you look at the 24 hours, small study here, but 6 out of 6 had nausea, 5 out of 6 had vomiting. The 72-hour, 3 out of 7 had nausea, 0 of the 7 had vomiting. There was less nerve damage and less neutropenia, so less decrease in white blood cell count. And why would this be? Again, as I mentioned, when you fast, your cells turn into more of a quiescent or repair mode, and chemotherapy really targets cells that are more rapidly dividing. And so if it's kind of turning the cells off, and then maybe they're a little bit more resistant to the chemotherapy damage. This is, again, looking at that study, looking at bone marrow suppression. There's more white blood cell survival in the 72-hour fasting versus the 24-hour fasting. You see the 24-hour fasting, more suppression in white blood cell count. So there is a systematic review here of 22 studies, and they found less side effects and improved survival in those having undergone intermittent fasting or time-restricted eating. The majority of these studies were animal studies, but there were some human studies as well, but they are more preliminary. So this is still early data. There are a number of studies looking at autoimmune and fasting, and this was a consensus guidelines. It says fasting has shown beneficial effects in various chronic diseases with highest levels of evidence for rheumatic or autoimmune diseases. So we know, looking at folks with rheumatoid arthritis, there is a genetic component, but it accounts for less than 30%. So if you have rheumatoid arthritis, if you have an identical twin, there's a less than 30% chance of having concordance, meaning that over 70% there is some kind of external factors that play a role. Clearly genetics has a role, but probably the bigger factor is some kind of environmental factor. So this was a systematic review looking at fasting followed by a vegetarian diet in patients with rheumatoid arthritis. They reviewed 31 fasting studies for rheumatoid arthritis. 4 of them were controlled trials, and they found that pulling these studies showed statistically and clinically significant benefits and a beneficial long-term effect. So here's one of those studies. Again, in this study, they looked at 7 to 10 days of a subtotal fast, which was like vegetable broths, teas, carrot juice, and then 3 to 5 months of a vegan, gluten-free diet. Then they transitioned to a lacto-ovo-vegetarian diet for months 5 through 13. And you can look here, the SED-rate ESR, where there was a clear improvement in the diet group versus the control, C-reactive protein, and white blood cell counts all improved with this intermittent fasting with a plant-based diet. Fasting improved joint pain, morning stiffness, grip strength, tender joints, swollen joints. So all of these things you can see statistically and clinically significant improvements in all of those with intermittent fasting followed by a plant-based diet. So here's 10 measures of inflammation decrease after fasting followed by a vegan vegetarian diet. Again, very similar protocol here. This is an older study from the 90s, but they did a 7 to 10 day fast, again, using vegetable broths, herbal teas, small amount of juice. And then they followed a strict vegan diet, limit processed food for 3 to 4 months. And then they transitioned to a lacto-ovo-vegetarian diet the remainder of the year. And markers of inflammation were notably improved. So this is a recent randomized controlled trial in 2025 in the journal Gastroenterology on Crohn's disease. That's something I have a particular interest in since I have Crohn's. They did an 8 to 16 intermittent fasting, so 8 hours of eating, 16 hours of fasting with water. They did it 6 days a week for 12 weeks. There was absolutely no change in diet, food, calorie intake. It was just the timing of eating. And what did they find? They found marked improvement of disease activity in the Harvey-Bradshaw Index, 40% decrease in stool frequency, 50% reduction in abdominal discomfort, and markers of inflammation were decreased. So fairly significant findings without changing the diet, just doing intermittent or time-restricted fasting. Intermittent fasting has been shown to increase BDNF. It's brain-derived neurotropic factor, important for brain health, for growth and repair of neurons, memory, mood, and neurodegenerative processes like Parkinson's and dementia. So intermittent fasting has been shown to increase that. What else is BDNF, brain-derived neurotropic factor, increased by? Well, it's been shown intermittent fasting has a profound impact on it. Exercise, getting adequate sleep. There's studies on turmeric. There's studies on nuts improving BDNF. I've also seen studies on things like saunas and hydrotherapy improving BDNF. So hugely important for your brain health. It is depleted by poor sleep, and high-fat meals lower BDNF by about 20% within hours. Intermittent fasting in Parkinson's disease. Parkinson's disease is characterized by loss of dopamine neurons in the substantia nigra, and you get these misfolded alpha-synuclein protein accumulation and inflammation and mitochondrial dysfunction. And both animal and human studies show improvement with intermittent fasting. So this is intermittent fasting studies, reduces that alpha-synuclein pathology and functional decline in a mouse model. So hey, this is not a human model, but it is a mouse model. 4 weeks, alternate day intermittent fasting diet had improved dopamine levels, improved alpha-synuclein clearance, and improved motor function. But again, this is a mouse model of Parkinson's, not a human study. There's a primate model showing improvement with 30% less calories for 6 months, better function, and better dopamine production. So this was a human study with Parkinson's disease, and it showed that prolonged fasting followed by time-restricted eating improved motor and non-motor symptoms in Parkinson's disease. So 31 patients, 1 week fast of 350 calories per day, which would equate to about 2 small apples or a cup of rice and small portion of veggies. Then, after that 1 week, they did the 16-8 fast of eating within an 8-hour window, and then water fasting for 16 hours. They did mention less consumption of animal products were reported, and there were significant improvements of motor function in these Parkinson's patients. Fasting and arthritis. So this was an uncontrolled study on the effects of fasting in people with arthritis. There was a 2.7 drop in pain, and that is a clinically meaningful drop in pain. This is not a controlled trial. The majority dropped medications as well. So we know that intermittent fasting lowers markers of inflammation, and here's a case series showing an improvement in arthritis pain. So in summary, we've talked about low-carb diets, Mediterranean diets, plant-based diets, and intermittent fasting, and the data for each of these. And of course, there's more data that could be covered, but this is an overview. So I wanted to share my story. As I had mentioned earlier, I do have Crohn's disease, and it was in my late 20s. I started developing some joint pain in my fingers, but also in my feet. Ultimately, I was diagnosed with Crohn's, and Crohn's is an autoimmune attack on the GI system, but it can have other manifestations as well, including joint pain, so-called seronegative spondyloarthropathy, and it's associated with these HLA-B27 arthritises like Crohn's can do it. Psoriasis or psoriatic arthritis is very similar. Ankylosing spondylitis, reactive arthritis are all forms of the similar type of arthritises, and that's what really seemed to bother me, from a joint perspective. So I'll show you a few of the pictures of the joints as they bothered me. You can see my finger here really swelling up. This is a so-called sausage digit that you get with those seronegative spondyloarthropathies, including Crohn's disease or inflammatory bowel disease. You can see there, swollen. You can see how my finger, inability to straighten it out fully. You see my ring finger really quite swollen again. And again, difficulty or inability to straighten the finger out. So this would bother me intermittently, and was really the more problematic issue that I complained of. And I felt something has got to give. My joints, my GI bothered me, but it was really my joints that really bothered me. So this was very humbling. I did everything I could, but still suffered with this. So I tried a few different things to try to get this under control. I tried to be as healthy as I could. I went on a whole food plant-based diet. I cut sugar, got exercise, drank plenty of water, sleep, tried to get outside sunshine. I even tried an elimination diet, trying to figure out if there's something I was eating. I could never figure out what it was. And ultimately, I went on a biologic agent, an infusion called Entyvio, which was every 2 months, or every 8 weeks. It was $10,000. And that did help my Crohn's disease. The scopes looked better on that. I still struggled some with the joint disease. So ultimately, I tried going 2 meals a day, the intermittent fasting, and that seemed to flip the switch for me. Again, since I've been doing that along with the other healthy things, trying to maintain a healthy lifestyle, my joints have not bothered me. When I go on vacation, start eating 3 meals a day, it's like a switch that my fingers start bothering me. I'm like, oh, I need to go back to my 2 meals a day. And in reality, during a typical week, I probably 1 or 2 days out of the week, I will eat 3 meals a day. So I'm not perfect on this, but for the majority of the days, I do eat 2 meals a day, and it has made a tremendous difference. My joints do not bother me when I do that, and again, I've been doing this probably 7-8 years or so, and my endoscopies have looked good. I've actually been able to come off my infusions, so a huge help for me at least. So in summary, I just wanted to go through what we've talked about. A couple questions. The keto diet had what type of impact on cholesterol, bones, and muscles? Remember, the cholesterol worsens on a low-carb keto diet, worsening bone and muscle strength. Remember, we talked about what percent of muscle loss in CrossFit training on a keto diet after 3 months. Remember, it was an 8% muscle loss, lean muscle mass loss with low-carb diets. And only 2 factors with the Mediterranean diet that were protective for heart disease, according to that JAMA Internal Medicine Review article. And the two things were nuts and vegetables. There was no benefit with olive oil, the fish, and the wine. And BDNF, that brain-derived neurotropic factor, which is super important for your brain health, repair, and function, it was improved or increased by a few things. We mentioned intermittent fasting, exercise, nuts, turmeric, sauna or hydrotherapy, and adequate sleep. It was negatively impacted by, remember I said, a high-fat meal within hours. There's a 27% drop in BDNF, and getting inadequate sleep has a negative impact on it as well. I would encourage you to visit the MedInfo LM or Lifestyle Medicine YouTube page. We have other lectures, so thank you for your time. Have a great day.